And we've done that in several other areas with returning vets. So there is value in the vets, and it's incumbent upon our organizations to go out there and let them know what we're about so they could help, tell us, this is what I could provide you. I wanted to comment on the experiences of a disabled vet that I met while I was at Duke. His name is Scott Smiley, and if the name sounds familiar, he's written a book. He was the Army Soldier of the Year in 2007, and I believe he was the first blind soldier to stay on active duty. He's a friend of mine. He commands a company up at West Point. And while we were at Duke, I met him on the first day and got to know him. And one of the things he told me is, I want to serve out my commitment in the Army, but eventually I'll have to leave. And but I don't know how I'm going to do anything outside of the Army. And I watched Scotty over 2 years sit in front of a classroom and with complex formulas written on a chalkboard, solve them by having someone describe it to him sitting next to him. I've seen him sit down and take exams in a statistics course where he could just describe the formula and have somebody else annotate it. And I've seen him use technology in order to communicate and build the PowerPoint presentations and the documents that are needed for analysis. A pretty incredible guy who probably underestimated his ability when he first started at Duke, but it's that type of person that we need to get to early while they're trying to figure out, what am I going to do? Can I do anything else? And show them, yes, you can do something. You have a lot of value, tremendous value, and you could be a part of our organization in this role. So thank you for inviting me up, and it's been a privilege to speak to you all.
Thank you very much for the comments. It's striking, and I think the thing that struck me is exactly what you said. When someone goes for an interview who's been in the Army for 10 months and said, describe something challenging you did, number one, does the person really want to describe it? And number two, does the person asking the question really want to get an answer in the way that you might describe it? And I think you're right, Governor. It goes back to what you said. That person asking the question needs to know what to ask and needs to know how to interpret that answer. And I think it's something that probably many of us take for granted and not understand that. And I think your comments, and I've admired CareCore for what they've done in this area, has been a great add, and I appreciate you coming and sharing that with us. Any other comments before we move on to the next area?
Can you hear me? My name is Veronica Valdez. I work for the Secretary of the Navy and Assistant Secretary of the Navy for Manpower and Reserve Affairs. I spearhead the Wounded Warrior Hiring and Support Initiative for the Department of the Navy. I work with our Wounded Warrior programs, both on the Marine Corps and the Navy side. And I just want to share with you just some comments. I just recently held an offsite with some of our employment coordinators that are working the field right now with our Wounded Warriors. What do we know? We know that for the Marine Corps, that the guys returning are very young. They go in thinking that they're in the Corps for their life, and they get wounded while they're on the field. They have not thought about a career outside of the Marine Corps. And so one of our challenges that we see over and over again was talking to that Marine and helping them think outside of the box. What are their abilities, and not focus on their disabilities? So the career assessment that Mr. Wahesh talked about, figuring out what career path that they're interested in is a big challenge for Wounded Warriors right now, and we're making progress in that area, helping them think about the fields, perhaps the healthcare industry. And what else do we know? They're returning home for their recovery a lot of the times where their support networks are. So perhaps we don't have Department of the Navy jobs available for them, and so we ask them to consider what other jobs might be in their communities where a lot of perhaps the healthcare industry are situated. Anytown, USA is what we hear a lot about. So unfortunately, we'd like to keep them within the family and hire them at the Department of the Navy, but many of the times they are going back to little towns that may not have jobs. So that's where you all come in to help us make those matches. I would encourage folks to think about entry-level positions. For the Marines, our wounded warriors are averaging the age of 19 and a half years old. And so and what we hear often is that there are jobs available, but what they see, and some of the employment coordinators, what they're seeing are positions that are perhaps mid-level, higher level. So we encourage you to take a look at entry-level positions and help them develop a career path towards that mid to high-level career. They are used to seeing a plan in front of them. They know what ranks they're working towards in the Corps or the Navy. So having the plan when they come in upon hiring, where they know where their career is developing towards, that would be really helpful. Mentorship. Mentorship has been very crucial in the retention piece of our wounded warriors within Department of the Navy when we hire them in as civilians. And we also hear stories for folks who are in the private sector now. So most of the time our Marines are successful when they go to employers who perhaps are Marines who own that company, or their fellow Marines have been employed by that company in the past. So some of the lessons learned have been that mentorship is crucial. So providing that one-on-one mentorship once they come on board has been critical. So again, one of the things, the challenges we hear is the resumes. Most of the time, these are the first time the Marines or the sailors are writing resumes. Perhaps they're unable to translate their military skills into civilian skills that are valuable in the workplace right now. So we are working towards improving that process, but I see resumes, in fact, this morning that have come through that I've worked in the private sector, and if I was recruiting that person, had I not known what their background was, it might be difficult for me to figure out whether this is the right fit for that company. So we're working with resumes, but we do encourage you to, if you do see a resume that perhaps might not fit a position that you have, to perhaps call that veteran or wounded warrior, talk to them, and see really, what their skill sets are, so that they can perhaps be a valuable team player in your companies. So those are just a couple of things I'd like to share with you. Again, I work for the Department of the Navy and Wounded Warrior Hiring and Support. I'm happy to share some of the lessons that we've learned, and we hire a lot of wounded warriors as well within Department of the Navy. So these are the things that I'm hearing from our employers. Thank you.
Thank you very much for the comments, and I think the issue of the resume is fascinating, because even in the private sector, when you're hiring folks who haven't been in military, you often take chances. You look at someone's resume that may or may not exactly fit the job, but you have a feel for that person and you have a feel for the community, and you go out on a limb and you do the right thing, and most of the time you're right. And I think the translation of a military background is a life experience as much as it is a military experience, and to take those life experiences and bring them into your community has tremendous value, not just in the job that they do every day, but in the morale that it creates within the working environment. When we talk about bringing veterans in, even to our organization, the level of support we get through the entire organization, just knowing that we've done that, changes the morale of the organization and gives people really a very positive spirit. So sometimes a resume doesn't describe a person. It describes an aspect of their life, and I would encourage you to think about the person and what they can bring, particularly in a 19 or a 20-year-old, where you really can create for them opportunities, whether they have that experience or not. It's a part of their education, and we have an obligation to meet that education. So thank you for your comments. I appreciate it. Let's go on to the last topic, which is really how do you support these veterans, and how do you support employers once they've brought those veterans on? And let me ask Mark Johnston, Deputy Assistant Secretary for Special Needs for the Office of Community Planning for HUD. You've been alluded to several times, so this is your big shot.
Thank you very much. My job at the U.S. Department of Housing and Urban Development is to help prevent and end homelessness. And a large part of every day when I'm at work is actually focused on veterans in particular. I've noticed a number of really interesting statistics related to unemployment today in terms of returning warriors, National Guard, et cetera, where the unemployment rates are incredibly high relative to the U.S. population. We just released a report with the VA just a few months ago on homeless veterans. It's the first one ever done at the federal level, and we found, shockingly, that the most significant finding for me after hearing about these unemployment rates was that of all low-income veterans, 10% will be on the streets this year. It's an incredibly high correlation between being a low-income veteran and falling into homelessness. For me, there's two real concerns about that. And the first one's obvious. It's immoral to think that people who've been defending us afar have come back to their home and literally are not in their homes. They're on the streets in increasing numbers. The other one is less obvious, but it is still very significant. That is, there's a very high societal cost to allowing homelessness to occur. I was in Los Angeles recently with the VA and other federal agencies, and the focus was on veterans. And we found some incredible costs there, and it's similar across the whole country. So the costs in LA, for instance, if you are homeless and you're on the streets, there really is a cost to LA City and LA County, because somebody on the streets isn't just sitting on that sidewalk or sitting in an emergency shelter throughout the year. When they get ill, they go to a hospital, and it's about a $700 ambulance ride to get there. It's about $1,500 a day to be in the hospital. If they start to have severe mental illness, that can easily be over $600 a day to be in a mental health facility. So there are some very significant, largely healthcare-related costs to allowing homelessness to happen. If that poor homeless veteran is sleeping on the streets and is arrested by the local sheriff, that's about $150 a day to be in jail. That is borne by the taxpayers in that city. And that really does occur across the country. The studies indicate that it costs about $40,000 a year to do nothing. And in other words, that's the cost of a homeless person cycling through these various public institutions that were never designed to solve homelessness. So HUD and VA in particular, but other agencies as well, have been focusing a lot in this particular administration on this topic. HUD and VA run a national program where HUD provides housing and the VA provides health care for homeless veterans. And we've seen some great results in the last 2 to 3 years. Something that Secretary Solis did not mention, because she had so much to cover, was that she is the chair of the U.S. Interagency Council on Homelessness, which is a 19-member agency body. My secretary at HUD is a member. Labor, VA, HHS are all core members of this. And we've focused a lot on how to end homelessness. One of the primary goals is to literally end veteran homelessness by 2015 with very specific metrics that we're tracking over time to see how we're doing. And while I'm spending a fair amount of time talking about homelessness, I really want to say if we've allowed a veteran to become homeless, what a wasted opportunity. We have now 76,000 homeless veterans on the streets and in emergency shelters today. And that's what we shouldn't be allowing to happen. And I'm so heartened to hear the specifics you're talking about in terms of employing veterans so that you can actually help them become stable and never even come close to homelessness. HUD and the VA, Labor, and DOD are working on it and have just launched a demonstration program to help prevent homelessness, specifically among veterans, where we're attaching ourselves to different military installations across the country. In particular, the Seattle area, San Diego, Austin, Texas, Tampa, and upstate New York, where we have invested $2 million per site from HUD, and the other agencies also contribute resources to help on the housing, the health care, and the services and jobs in those sites. And if you service any of those areas and you think you might have an opportunity to provide jobs to veterans, we would love to talk to you about that, to link you up with this national demonstration. So in closing, I think what I would simply like to say is I think employment is one of those key, vital predictive indicators on homelessness. If somebody has stable employment, their risk of homelessness drastically drops. So we're thrilled to be part of this today. Thank you.
Thank you. I think obviously the challenge, as you described resumes, is resumes of a homeless person who may not have been working for a while and finding those folks. So I think we collectively need to work with you and HUD and the VA to understand how to work through those issues. Those are probably unique issues that are probably different than some of the other things we've talked about that I think we all need to make a commitment to.